Was there one particular patient that you met?
There were two. Two things happened, both to do with very powerful women. The first powerful woman was a lady I'd known for over 10 years. She and her husband, I'd cared for them both. They both had poorly controlled diabetes and they were both very heavy. At the time, I could monitor how compliant my patients were with their medication. And if I'm to be truthful, in part, that was how I was paid. So part of my payment was to do with are the patients having, in this case, metformin, the most commonly used drug for type 2 diabetes.
Part of your payment?
Yeah.
What do you mean?
Well, because you're supposed to, the government approve of the fact that we give drugs that are needed for type 2 diabetes. So that you're given a sort of quota where it's regarded as good practice that such a certain percentage of your patients will be on metformin.
What? So is it fair to say that you were somewhat incentivized to give people metformin?
Yes, that would be true. But I think we should also be fair to say that the body of evidence at the time would say that it's good practice to give metformin to people with type 2 diabetes, and conversely, poor practice not to use metformin, but we'll develop that. So the backdrop is we're monitoring the patients who stop taking their metformin, because that is, number one, poor practice, and number two, actually costs me. So I wrote to the person, "Dear Mrs. So-and-so, I'm concerned that you don't seem to be taking your metformin. Please make an appointment with me at your earliest convenience." Very British, very polite. Anyway, nothing prepared me for what was going to happen that morning, and it's changed my entire life on that point. So the lady, let's call her Mrs. Jones. That wasn't her name. She marches in and she said to me, "You think you're going to tell me off, don't you, Dr. Unwin? Well, I've got news for you. I'm going to tell you off." I was scared, like, what's going on? She'd never been like this before. She was a polite person. Anyway, she went on to explain. She said, "When you do my blood tests, you will find that my blood glucose is completely normal, despite not taking your metformin." And she said, "I'm wondering if you're actually qualified as a doctor, because in the last 10 years, did you ever once tell me that bread was sugar or breakfast cereals were sugar?